Did you know studies show that keeping your A1C at 7% or lower can seriously cut your risk of diabetes complications like problems with your eyes, kidneys, or nerves? In fact, dropping your A1C by just 1% can lower your risk of those issues by up to 30%. Hey everyone! Today, we're diving into a topic that I know a lot of you have been curious about, A1C. Yep, that mysterious little term that pops up when you're talking about diabetes. I got a great question from many folk. What's normal blood sugar? Yo, what's this A1C thing you mentioned? And I bet a bunch of you are wondering the same thing. So let's break it down in a way that's super clear, super chill, and makes you feel like an A1C expert by the end of this. Grab a snack, maybe a low-carb one, and let's get started. No need to be a tech wizard. We make it easy. Using some cool tech, we can keep an eye on your diabetes, help cut down on meds, and make sure you're feeling your best, all without you having to trek to a doctor's office. Pretty sweet, right? All right, let's talk A1C. Oh, and before we start, quick shout out. If you love getting health tips, recipes, and all kinds of helpful practical tips, welcome to the Diabetic 365 crew, where we're all about making health simple and doable. Our team of endocrinologists and certified diabetes educators is here to share real-world tips to help you manage diabetes, insulin resistance, or just live your healthiest life. I'd love your support to keep these tips coming. If you're vibing with this video, hit that like button, subscribe, and tap the bell so you don't miss a thing. In the comments, drop a 1 if you're loving this topic, or a 0 if it's not quite your jam. Your feedback helps us make content you'll find awesome. So, A1C, why do we keep talking about it? It's like the VIP of diabetes tests. A1C, or hemoglobin A1C, if you want to get fancy, is a blood test that gives us a snapshot of your average blood sugar levels over the past few months. But why is it called A1C? And what's it actually measuring? Let's break it down. Your blood has this protein called hemoglobin. It's the stuff in your red blood cells that carries oxygen from your lungs to every part of your body. Think of it like a delivery truck for oxygen. Now, this hemoglobin is also kind of like a sponge for glucose, the sugar floating around in your blood. The more sugar in your system, the more gets soaked up by your hemoglobin. So, when we test your A1C, we're checking how much glucose has glommed onto your hemoglobin. It's like a report card for your blood sugar over time. Why do we check it every 3 months? Well, your red blood cells, which carry that hemoglobin, live for about 90 days. So, the A1C test shows us the glucose that's built up in those cells over that time. It's not just a one-day snapshot, it's the big picture of how your blood sugar's been behaving. Cool, right? What do those A1C numbers mean? All right, so you get your A1C results, and it's a number like 6%, 7%, or maybe 10%. But what does that actually tell you? I ask my patients this all the time, and they're like, I think it's supposed to be under 7 or maybe 6.5. They're not sure, and that's okay. By the end of this, you're going to know exactly what's up. Here's the deal. Your A1C is reported as a percentage, and that percentage matches up to an average blood sugar level. Think of it like a translator for your blood sugar. For example, an A1C of 6% means your average blood sugar is about 120 milligrams per deciliter. 7% is around 150 milligrams per deciliter. 8% is about 180 milligrams per deciliter. And it keeps going. Like a 12% A1C, that's roughly 300 milligrams per deciliter. Yikes! The math is pretty simple. For every 1% change in your A1C, your average blood sugar shifts by about 30 milligrams per deciliter. So if your A1C goes from 6% to 7%, your average blood sugar is creeping up by 30 points. Easy to wrap your head around, right? By knowing your A1C, you can get a sense of how your diabetes is doing overall, not just how you're feeling on one random day. What's a good A1C goal? Now, here's where it gets personal. What should your A1C be? You've probably heard all sorts of numbers thrown around, like under 7 or aim for 6.5. So, what's the deal? Well, doctors usually say the universal goal for most people with diabetes is an A1C below 7%. Why? Because studies show that keeping your A1C at 7% or lower can seriously cut your risk of diabetes complications, like problems with your eyes, kidneys, or nerves. In fact, dropping your A1C by just 1% can lower your risk of those issues by up to 30%. That's huge. But here's the thing. The perfect A1C depends on you. If you're younger, newly diagnosed, or in the first 5 to 10 years of diabetes, we might aim lower, like 6.5% or even 6%. I've got patients rocking A1Cs of 5.7 or 5.5, not even in the diabetic range, because they're killing it with lifestyle changes and the right care. It's like they're living almost diabetes-free. But for others, especially if you're older or have other health conditions, a super low A1C might not be the best idea. Let's talk about why. The catch with A1C: it's not the whole story. A 1C is awesome, but it's not perfect. It tells us your average blood sugar, but it doesn't show the wild ups and downs your blood sugar might be doing. Imagine you're driving a car, and your A1C is like the average speed you've been going. But it doesn't tell us if you were zooming at 100 miles per hour 1 minute and crawling at 20 miles per hour the next. Those swings matter. For example, let's say you have an A1C of 7%, which is about 150 milligrams per deciliter on average. That could mean your blood sugar's hanging out nicely between 130 and 180 most of the time. Pretty stable, not bad. But you could also have the same 7% A1C if your blood sugar's crashing to 50 one day and spiking to 250 the next. Those lows and highs cancel each other out in the average, but they're not great for your body. Big swings can make you feel awful and increase your risk of complications. This is where low blood sugars or hypoglycemia come in. If you're on meds that push your blood sugar too low too often, your A1C might look great, but you're not doing great. Low blood sugar is no joke. Shaky, sweaty, dizzy, or even passing out. Not fun. So a good diabetes doc, like me, focuses on keeping your A1C low without letting you dip into those scary lows. It's all about balance. How low is too low? Some folks get super fixated on hitting a specific A1C, like, I gotta get to 6% no matter what. I get it. It's tempting to chase that perfect number. But here's the truth. Pushing your A1C too low with heavy meds can backfire. There's this big study called the ACCORD study. Look it up if you're curious. They tried to get everyone's A1C as low as possible with tons of meds. And guess what? More people actually passed away, likely because of too many low blood sugar episodes. That's a wake-up call. So, my motto is, aim for an A1C that's as low as reasonably achievable. That means low enough to keep you healthy and reduce complications, but not so low that you're having low blood sugars all the time. If you're at 6% but feeling awful from lows, I'd rather see you at 6.5% or even 7% and feeling good. It's not just about the number. It's about your health and quality of life. If your doc's ignoring your low blood sugar episodes just to hit a target, it might be time for a heart-to-heart or maybe a new doc. A 1C and fluctuations, the real deal. Let's dig a little deeper into those blood sugar swings. Say you go to your doctor and your A1C is 7%. They're like, sweet, you're good. But hold up, are you really? If your blood sugar's bouncing between 50 and 250, that 7% is hiding some chaos. Those highs can damage your body over time, and the lows are just plain miserable. That's why at Sugar MDs, we don't just look at A1C. We want the full picture. This is where tech comes in handy. Continuous glucose monitors like the Dexcom G6 or Freestyle Libre are game changers. These little devices stick on your skin and track your blood sugar 24/7, showing every peak and valley. You'll be shocked at how much your sugar can bounce around in a day. If you're not using a CGM, we can still track your fingerstick readings remotely through our app. I can peek at your numbers from my screen and spot any trouble before it becomes a big deal. No waiting 3 months for an A1C test. We're on it in real time. Why A1C can be tricky. Okay, A1C is great, but it's not foolproof. Sometimes it can give you a wonky reading, especially if something's up with your hemoglobin. Remember, A1C depends on those red blood cells doing their thing for 3 months. But if you've got issues like anemia, low hemoglobin from stuff like iron, or B12 deficiency, chronic kidney disease, where meds like EPO can mess with your red cells, blood transfusions, or bleeding, which can dilute or change your hemoglobin. Conditions like sickle cell disease or thalassemia, where red cells don't act normal. Then your A1C might not tell the true story. For example, if you're anemic, your red cells might die faster, so your A1C could look lower than it should. Or if you've had a transfusion, you're mixing in fresh cells that haven't had time to soak up glucose, which can throw things off. What do we do if A1C isn't reliable? No worries, we've got options. Continuous glucose monitoring, CGMs, are the gold standard. Even if you don't have a personal one, we can use a professional CGM for a week or two to see what's really going on. Fructosamine test. This measures blood sugar over a shorter period, like 2 to 3 weeks. It's a good backup if A1C is sketchy. Glycated albumin, or glycomark. These are other tests that can give us clues about your blood sugar, though some meds, like SGLT2 inhibitors, can mess with glycomark. Checking your blood sugar regularly with a glucometer. A1C and pregnancy. Quick note for the expecting moms out there with gestational diabetes or type 1/type 2 diabetes. Can you rely on A1C when you're pregnant? Kinda, but it's tricky. Pregnancy changes your blood volume and how your red blood cells work, so A1C can sometimes read lower than it should. A1C lab variations. One more thing to know, A1C results can vary slightly depending on where you get tested. If you check your A1C at your doctor's office and then go to a different lab, you might see a small difference, like 6.8% at one place and 7.1% at another. Don't panic. It's just how labs work. Stick with the same lab if you can, so you're comparing apples to apples. The real value of A1C is seeing the trend over time. If you're dropping from 9% to 8% to 7%, that's a high five moment, even if the exact number wiggles a bit. All right, let's bring it home. A1C is your go-to test for understanding your average blood sugar over 3 months. It's like a window into how your diabetes is doing, measured as a percentage that ties to your blood sugar levels. 6% is 120, 7% is 150, and so on. The goal is usually under 7% to keep complications at bay, but we tailor it to you, maybe lower if you're young and healthy, or a bit higher if lows are a problem. Just remember, A1C doesn't tell us about swings, so we pair it with CGMs or finger sticks to get the full scoop. If your hemoglobin's acting up, like with anemia or sickle cell, A1C might not be trustworthy, but we've got other tests like fructosamine or glycomark to back us up. And for pregnant folks, A1C's helpful, but needs to team up with daily checks. The key is balance, keeping your A1C low enough to stay healthy without crashing into lows that make you feel rotten. If you found this helpful, give it a thumbs up and hit that subscribe button. We're dropping new videos every week to keep you informed and inspired. And don't forget to check out Diabetic 365 for more tips, remote care. Thanks for hanging out. You rock. Catch you in the next video. Stay healthy, stay awesome.